Time now for Restoring the Soul of Healthcare from the HELPcare Clinic in Austin.
And it is that time. Every Thursday we get together with the HELPcare Clinic and visit about some very important and interesting topics. We say good morning to Dr. David Strobel and Lee Aase at the HELPcare Clinic. Gentlemen, good morning.
Good morning, John.
Glad to be with you.
Always good to visit with you. And I saw our discussion points today are talking about specifically Fibroscan, and I said my knowledge of Fibroscan kind of tops out at being able to pronounce it. So what is Fibroscan and why is it important to us?
Yeah, well, one thing I just highlight with this is that our approach at HELPcare Clinic is that we want to be Norman Rockwell meets the Jetsons. So we want to have that personal feel, that small town, unhurried, sort of non-corporate kind of medicine practice. But Norman Rockwell meets the Jetsons. We want to use technology when it really makes sense, and Fibroscan is one of those that really has a lot of benefits. And we first introduced this about 3 months ago, into the practice, and we thought it'd be helpful for Dr. Strobel to sort of refresh people on both the reasons for wanting to do this and also then some of the benefits that we have through having that Fibroscan available.
Okay.
So the Fibroscan, once again, is an ultrasound device, but it's not like a normal ultrasound that generates images so that you can kind of see what things look like. It's actually measuring the characteristics of the tissue that the ultrasound waves are passing through, bouncing off of. And so it does a couple of different things. One is that it allows us to measure, at least reasonably accurately, the amount of fat that is in the liver compared to other tissues that might be there, like regular liver tissue and blood vessels and things like that. And then it also allows us to measure the amount of scar tissue that is in the liver. And scar tissue forms like it does anywhere as a result of inflammation or tissue injury. And the liver is a place where tissue injury can occur without you feeling it at all. When the liver is inflamed, that's called hepatitis. That's a generic term. People think of hepatitis as being caused by infection, but that's one cause, but there are other causes of hepatitis. And anything that causes liver inflammation will cause a need for healing. And part of the healing process is to make scar. And because the liver has the potential to regenerate tissue that's been lost, sometimes what happens is you get recurrent and ongoing inflammation over and over and over, and then scar builds up more and more and more, and pretty soon you've got a lot of scar. And so now the liver is stiff. Some of the normal liver tissue has been replaced by scar. The blood flow through the liver is slowed down because it's stiff and it's pinching on the blood vessels. And pretty soon you're starting to have liver malfunction. So detecting that at an early point is very, very important. And there are some very good things that can be done to either halt or potentially even reverse some of those characteristics if you find them before they're really bad.
I would think the majority of people know and understand the importance of the liver in the body, but just in a nutshell, you're talking about blood flow in the liver and the things that the liver does. Why, if you can, why that is so critically important to all of us.
Sure. Well, the liver does a lot of stuff. Probably the main thing that it does is that all of the blood that comes out of your intestine goes through the liver first. And so the liver's job is to say, okay, what in this food that you just ate is okay to go into the blood and what is not okay. And anything that's not okay to go into the blood, the liver has a bunch of different ways that it figures out how to get rid of it. Sometimes it throws it back into the intestine in a way that it doesn't get reabsorbed. Sometimes it changes it so that it can be metabolized into something that is then urinated out by putting it in the blood. And sometimes it just deactivates things so that what was not safe before now just has become safe, and it's okay for it to be in the blood. A lot of different mechanisms. And then it also produces a lot of synthetic function. In other words, it makes things. So it's the main source of cholesterol in your body. You need cholesterol all over your body. It's very important. And it makes also a lot of clotting factors, and it's the main source of the main protein that's in the blood. So it's a manufacturing center too. And then it's also something that throws away some waste products into the bile and turns waste products into bile, which is basically a kind of detergent that helps break up fat. So it really has a lot of different functions, and they're interrelated, but it's almost like it's multiple organs all in one.
Yeah, and so Dr. Dave really highlights here why it's, he talked a little earlier about how you don't feel inflammation in your liver when it's happening, and so it's important to have a device like the Fibroscan that enables us to get, or enables him to get early warning of this, to be able, there are some things like metabolic syndrome that tend, as well as, history of alcohol consumption and other things that tend to point toward the possibility of liver inflammation. But through the Fibroscan, he's able to get not a picture, but a measurement that indicates whether that is in fact happening.
And it's been very, very illustrative. We've had several patients that we've discovered have significantly advanced fibrosis. That's, a significant scar. We haven't had anybody so far at HELPcare Clinic where we've discovered the level 4 scarring, which is called F4. That's cirrhosis. But we have had a couple of patients that have F3 scarring. And some of these folks, one in particular I'm thinking of, has made some significant lifestyle changes. And I don't know that will reverse this. My assumption is it probably won't. But he feels so much better with the lifestyle changes that he has simply elected to observe this. And we'll be monitoring it with blood tests and with repeat Fibroscan in several other ways, too, just to look into it. And so by doing that, he's really used this as an impetus to make the lifestyle changes, and it's really made a difference for him symptomatically.
It kind of gets us back to a kind of a recurring theme we talk about. It's that knowledge is power. Now that he understands what's going on, he can do something about it.
Right. And early knowledge allows better power.
Sure.
Right. Yeah, before more damage is done. So be better to get it at F2 or F1. But if you're at least the sooner you find out, the sooner you can make the lifestyle changes. So we've included Fibroscan imaging for all of the member patients of HELPcare Clinic. But we also, this is one of the couple of things that we're saying for people who aren't members or aren't yet members, if they'd like to get a Fibroscan, we're offering that at a discounted rate as well. So in some other places, you might expect to pay around $320 for this kind of scan if you're paying cash for it. At HELPcare Clinic, it's $159 for our non-members. But again, it's included in our monthly membership as needed and as appropriate. And frankly, if somebody wants to get it done and they're a member, Dr. Dave is very inclined to just do that. The other thing that we wanted to highlight as well and remind people of is the in-body, which is the body composition, another Jetson's device that we have that enables measurement of body fat percentage, of muscle mass, and gives a lot of, throughout very specifically within the body, where is the fat located, how much excess fat do you have, how much do you have a deficiency in muscle mass, and that's something that can be just as important. And that's something that, again, is included in membership. But just in the last 2 weeks, we've had 30 patients come so far to get that done. And we do offer that also a la carte as a separate offering for $50. So for people who maybe just want to get some information, get a taste of HELPcare Clinic and the difference here, that'd be one way for them to do that.
I always say we just wish we had more time to be able to get more into this. Let's remind people where you are, how they can get more information, and even how they can become a member of the HELPcare Clinic.
Sure, absolutely. We're at 308 4th Avenue Northwest, which is a block east of St. Augustine's. So people can stop by here 8 to 5 Monday through Friday or 8 to noon on Saturday. The office is open. And we also can have them call us at 507-279-2345. Or on the web, they can go to HELPcare.health and click the link that says HELPcare Clinic Austin, and they'll find out more about it.
All right, very good. Always fascinating topics. Like noted, because you have this posted on your website about liver disease, and the highlight that shocked me was that it's projected that looking at that's going to go up like 56% over the next 10 years. And I'd rather know in advance if I'm headed that direction than wait to the last minute.
Exactly.
Absolutely. Right. That's what we're here for.
All right. Great stuff.
Thanks, John.
As always, we'll look forward to talking to you again next week.
Yes.
Good deal.
Blessings to you.
All right. Thank you very much. Bye-bye.